Hey, folks, welcome back to the show. Today's episode is with a repeat guest, the wonderful Dr. Kent Holtorf. He is the man behind Integrative Peptides, which are some of the most innovative oral peptide formulas around. Dr. Holtorf, at the time of recording this podcast, was working pretty hard on a new book on Lyme disease and mold and how peptides can be helpful in dealing with those conditions. So we talk about oral peptides, we talk about Lyme and mold, lots of great conversation here. So you're going to want to get out a pen and a notepad and take some notes. So if you decide you want to go to Integrative Peptides and buy yourself some peptides, we have a great discount code for our listeners, which is longevity10. So thank you so much for being here. If you're looking to connect with me, you know that you can always do that through my website, natniddam.com. And while you're there, check out the page on the BSP community, which is my new community on Mighty Networks, where we do amazing stuff. We do live Q&As. We share lots of amazing content. And we have a lot of these podcast experts come in and do live Q&As just for the members. Check it out. So thank you again for being here. Enjoy. Hey, folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome back to the show, Dr. Kent Holtorf. It's been far too long, and I can't wait to record this. Thank you so much for agreeing to be here.
Thank you. It's always a pleasure. We always spend all our time before talking. Oh, we got a podcast to do.
I think it's a problem of mine, I have to say. Anyway, today's topic. So it all started when you sent me a draft of your upcoming novella. I don't know. It's a book as far as I'm concerned. I don't care how many pages it is. The information that is packed into this book, I think, is going to really, really help a lot of people.
It was supposed to be 8 pages. I was doing a chapter for someone, and it ended up being 88. Now I just added another 22 pages. So that's the problem. I have probably 20 books that are 80% done because I keep adding. I'm like,
well, this is one you want to get out there. I think it's called, and I'm going to read it out here because when this podcast hits, if it's not out, people are going to be clamoring. They're going to be writing you saying, Dr. Holtorf, where's the mold illness?
I've already mentioned, I'm already getting that.
Yeah. So rapid. And, I think what's going to get people's attention is the idea of what you're saying here, rapid treatment of chronic inflammatory response syndrome, CIRS, which frankly is an oxymoron to most people, right?
Yeah. And what started when we had so many people coming in with serious treatment, very knowledgeable doctors. Okay, great treatment. But I'm like, I'm very ADD. I'm like, okay, they're like, it's 8 years. I know I'm going to get better. I know. I'm like, I would have given up at 3 months. So let's see how we get this faster. And we've learned, from my illness and where the immune system is key. Mm-hmm. And if you look at the current protocol in the pyramid, it's kind of fix the immune system last, where get rid of the infection and the toxins, and then the immune system will come back. Well, now we have the ability to directly affect the immune system first, and so you can get better much quicker.
Yeah.
And when you look at all these, and what's kind of amazing, and I kind of feel it's a little bit cheating almost, all these, whether it's ALS, Alzheimer's, MS, long COVID, chronic fatigue syndrome, Crohn's, all these things, they have the same pattern in their immune system. And it's the same pattern as an aged person. So, and with involution of the thymus, you get this basically, it's an oversimplification, but TH1, Treg, and TH2, TH17, usually they're balanced. Mm-hmm. So as you get older, or if you're stressed, or you get exposed to toxins, or an infection, or EMFs, whatever it may be, it starts going like this. Now you're prone to, for instance, natural killer cell function is a downstream marker for TH1. And that will basically determine your chance of getting intercellular infections.
Hmm.
And that's why when I find that a young person gets shingles, low immunity, and also cancer. And or people will get chemo, wipes out those natural killer cells.
Right. So that's the Th1 side. It goes down.
Yeah. And that's the number one thing to tell you how long you're going to relapse. And it's like these people get colon cancer. They go, oh, you're cured 5 years. I'm telling you, 6 years, it's like everywhere. And so, but all this side is all inflammation.
That's the Th2, Th17. I'm just saying that because people listening won't know what this site is.
Yeah. Yeah.
Sorry.
And so that Th17 is also very basically prone to autoimmunity and all that. So if you can bring it back, you have a much immune system and you're able to the infections. For instance, when I had Lyme and Babesia and Bartonella products at 7 at a time, 10 times a dose, it didn't work. Why? My natural killer cell function was 0.
Yeah.
Like you could never kill it. So when you raise that, it's like a teeter-totter, it lowers the inflammation now, and there's also a vicious cycle associated with that. So you get basically when this is low, now you get reactivating other infections, you get, Epstein-Barr, HHV6, causes more inflammation. You get the pineal, hypothalamic, pituitary hormone axis gets screwed up. So all the hormones are low, but they're, for instance, like, TSH, we look for high TSH, shows low thyroid, but it's low. And they'll actually have high T4, which I won't go into that, but so doctors go, that's high thyroid. No, it's a marker of low. But basically everything's low. And a big one is human transforming growth factor beta. And it really drives that Th17 for autoimmunity. And if you look at Sears patients, chronic Lyme, and I kind of mix those together because
well, they come together, right?
Yeah, and it's rare for a healthy person to go into a moldy area and get sick, right? It's have something else going on. And one thing that's way, doctors like basically pretend like it's psychosomatic stress. Stress does not lower your immune system, it modulates it like this.
Interesting.
Yeah, and then you add all the toxins, pesticides, EMFs, any other chronic illness, and really emotional stress we find really drives it. So, and that's what people will often get it. Let's say someone has Lyme, like a healthy person may never have symptoms, like you suppress it. It's kind of like you get chickenpox, like I'm over the chickenpox. Well, you're not really, your body suppressed it, comes back out as shingles. And when someone has shingles, that's low Th1. And so what they want to do, give you a vaccine, which does this, it makes it
even
worse.
more. Yeah.
And so we found, we're kind of becoming an immune modulatory clinic, but it's become so powerful for so many things. And even, these complex illnesses, because it's a vicious cycle, and you get immune activation of coagulation, you get, basically brain inflammation, the blood-brain barrier goes kaput, the GI system, that gets permeable. Now you get everything's a vicious cycle. So it's kind of, well, where do you start? And so a lot of people will start with, well, let's fix the gut. Okay, I mean, none of these are wrong. Let's get rid of the toxins. Okay, you want to do that anyways and get the heck out of the moldy area.
Right.
Or we've had a family come in and they were so sick, and I'm like, something's not right. Like, where do you live? And they're like, well, we just inherited a ranch from my grandfather, and it was a mine, and if you dig down 1 inch, the ground is yellow. I'm like, get the hell out.
Oh my God.
Like, well, it's worth so much. I'm like, is it worth your health? But it's, we're being bombarded with this stuff. And I remember I was at an environmental conference and I was bored or whatever. And I went to the bar and I opened up USA Today, and not on the cover, but on the inside cover, there was a killer whale that was beached on an iceberg, and they dead, and they biopsied his blubber. It died of PCB over
Wow.
there. And that's
Yeah.
been banned for 50 years.
Yeah, but it's bioaccumulating in
Yeah.
the environment.
And,
Yeah.
and so we have like, so everyone is kind of a Sears patient. And
Yeah.
it's just once you get to a certain level and you get this infection, you get emotional stress, now you become officially a Sears. You may get diagnosed with chronic fatigue syndrome, fibromyalgia, or depression, bipolar, malingering, crazy, and I found, I think doctors as a whole, I don't want to be doctor bashing because there's always great exceptions, but if a doctor doesn't know what it is, it's your fault,
Yeah.
especially multi-system. They don't have the time. They're also in a system that doesn't allow them. Like you get this chronic fatigue syndrome patient or Sears patient, and once someone says Sears or chronic fatigue syndrome, the doctors roll their eyes, and they have 8 minutes to try to treat that. I mean,
Yeah.
I can't say hello in 8 minutes.
Yeah.
And so, we can pick out, these these dysfunctions on blood work without talking to the patient and how serious it is. Like, yeah, it's a chronic fatigue syndrome patient, likely have Lyme, even though we don't test Lyme, like initially. I mean, sometimes we do, but I mean, they got some chronic infection, likely a toxin and stress.
Mm-hmm.
It's that triad that is a killer. And we're finding, Alzheimer's is just exploding. Everyone's sick. I go
Yeah.
to a party, I have to bring lab slips.
Yeah.
And it is, everyone comes up and they go, oh, I'm so sick, or my daughter's so sick. But it's funny, I stopped doing it because I'll say, well, you need this. Well, my doctor said that's not it. Well, how's that working for you?
Yeah. Yeah.
And
No, for sure.
they checked my cholesterol and they said, I'm on a
It's
statin.
fine. Or it's
Yeah.
fine.
Yeah. And I'm like, well, if you don't check anything and you get the test and they keep doing a CBC, a cholesterol, a TSH over and over and over, you're fine. It's all in your head. Here's a, take some Prozac or whatever it may be.
Yeah.
And it's crazy. And it also even goes along with weight gain. And, we don't eat great, but I think we're also, and we'll check everyone's metabolism when they come in, right? With how much oxygen they burn, and also the thyroflex, which checks the tissue level of thyroid. British Medical Journal showed it's more accurate than a blood test, and they're usually 25% low. So
On resting metabolic rate.
yeah. And so even just, I kind of started, my first practice was a family practice, and I just started changing it to a thyroid optimization clinic. Never advertised, it was just packed. Just learning how to do T3 right is huge. That's just one piece of the puzzle.
Yeah.
But so many of these things. So, and most things work for 20 to 30%, and some but if you have enough of those things, then you're going to get that sick patient that's been everywhere much better.
Yeah. Well, and I think that, what I love about this book and what you said, like on the front of the book, it says mold illness, but to your point, they are all related and they are all united by an immune system that's been disabled, right?
Yep.
And so the idea that what can we do to re-enable the immune system so that it is working in partnership with all of the other things that we're doing. Like at the end of the day, the human body is probably more powerful than anything we can possibly throw at it. And so if we can kind of kickstart the engine again, it's going to make you look like a hero because everything's going to work better.
And everything's a vicious cycle. And you look at really the immune system is the number one determinant of your biologic age.
Yes. Yeah.
And when we fix that, it lowers the inflammation, which is causing, dysfunction in the pineal, hypothalamic pituitary hormone system. It basically, people have all these reactivating infections. You get shingles, and they go, oh, let's take a vaccine. Well, let's look at your immune system.
Yeah, because it's an opportunistic infection. I think one of the things that people sort of don't get, it's almost like I caught shingles or I caught EBV or whatever, but many of these are dormant bugs that are just sitting there waiting for their curtain call. It's you're on, and you're on is whether it's a shock or chronic stress or whatever the case may be, and the immune system kind of like your vigilance goes down, your immune vigilance goes down, and that's where their moment to shine.
Yeah. And then it also goes to basically mitochondrial dysfunction,
Yeah.
which is huge. And now the cells don't have enough energy. I wrote a number of review articles on thyroid where you can't bring the thyroid into the cells. And so the levels in the serum look high because they're not getting into the cells.
Right.
But also, you look at every chronic illness, like all the neurodegenerative diseases, Alzheimer's, Parkinson's, fibromyalgia. I mean, they did muscle biopsies, fibromyalgia patients, look, and their mitochondrial dysfunctional. And so you need to fix those, but I don't want to get too crazy here and too many concepts, but we're now trying to do basically without TH1. So without that TH1, the natural killer cells also will kill all the cells in the body that are dysfunctional, the mitochondria are screwed up. If you look at a congestive heart failure patient, most of their cells in their heart, almost half, are senescent. So not only are they just sitting there they don't have to sit there doing nothing, they're secreting all this oxidation, recruiting other cells. Now, your body kills billions of cells every day. People kind of freak out and think, oh my gosh, autophagy, get rid of these cells. But you do that, and it's shown to reverse congestive heart failure, diabetes, reduces cancer. So that high TH1 or that low TH1, it can't kill those cells.
Right.
And so it kind of, everything's a vicious cycle. And so you want to do that. And also, if you look at, if you have an infection, if you have a cancer, if there's an antigen that is around for a long time, those T cells, they kind of give up. It's called T cell exhaustion. If you look at a cancer, all around the cancer are white cells. They're attacking it. They're almost protecting the cancer because they're not doing anything. They're senescent because they've been stimulated so much. So they just shut off. And so with some of the new immune therapies, they turn them back on. Sometimes like with senescence and T cell exhaustion, a little different mechanism. One, you kind of have to kill, maybe. The other one, you can reverse it. And a big way of doing that is TH1. And for instance, with low TH1, you can't convert IgM antibody to IgG. And IgM antibody is the first antibody that, let's say you get an infection. IgM antibody is a very weak antibody. Just kind of think of a dog like holding on to your pant leg, right?
Right.
IgG activates complement and blows your leg off, And for instance, like when I had Lyme, I had a 41 kilodalton IgM. Okay, so they say, oh, false positive. That's the most likely. It's a flagellum. I fixed my immune system. And so doctors say, you don't have Lyme, blah, blah, blah. Fixed the immune system. Then I had 8 IgG bands.
Right. You talk about this in the book. Like it literally, like it's almost like your body couldn't present the Lyme.
Yeah.
Like it was hidden because
Yeah.
the immune system was so depressed.
Yeah. It can't convert. It can't do all those things.
Like it almost can't react. So let me go back to the mitochondria, the dysfunctional mitochondria here. So, we're talking a lot about reactivating the immune system, and we're going to get into some of the ways that, some of the approaches that you're using to kind of fire it back up again. But where does the mitochondrial support come in? Or is it simply by taking care of the immune system that the mitochondria, like it kind of relieves the pressure on the mitochondria? Or do you at the same time want to support the mitochondria? Because, if your mitochondria is not working, there's not a whole lot of good that's going to happen in the body.
It's a very good question and no perfect answer, because if you, let's say you have a bunch of senescent cells that the mitochondria aren't making energy, they're making oxidation.
Yeah.
So you stimulate the mitochondria, now you're making it worse. So people
like, can you fix them? Yeah.
Yeah. So sometimes you have to say, well, let's kill those off first, which I think is going to be really the new rage, a new thing. And you're into that, I know, with the
senolytics. Yeah.
Yeah. And which is going to play a big part. But if you give some of these mitochondrial boosters, it a lot of them will also say even like mitoQ and PQQ and MOTS, and they'll basically suppress that oxidation and get the mitochondria working a little bit instead of secreting all this oxidation.
Right. So in a way, you want to bring in the senolytic to clear out the trash, and then you want to support the good guys with the nutrients.
Yeah,
to some degree.
Ideally.
I mean, and these are gross oversimplifications, to be clear. But, and on the senolytic side, I mean, there's some interesting stuff out there, right? I think True Diagnostic I think they published a study, or they did a study using dasatinib and quercetin, high dose quercetin. And I think it's 2 or 3 days a month. And they were able to show that had a beautiful effect by wiping out a lot. And you don't want no senescent cells. This is the other one. Like, you get people running around going, I got to kill all the senescent cells. I'm like, yeah, actually not really.
They have a function with cancer. They can cause cancer. They can also prevent cancer. But you got to watch out with the recommended doses, because I took it and then went on a trip to give a talk. Oh my God. And someone, like, I was at the airport and I was meeting someone. They're like, are you dying?
Because you took too much?
Yeah, well, I took the recommended dose,
Of the dasatinib and quercetin?
Yeah. So it was dasatinib, and which really, maybe I had a lot of senescent cells,
And dasatinib is it's a chemo drug, isn't it?
Yeah,
this is not good stuff.
Yeah, I really was resistant to use it with that, but when you look at it, it's kind of more of an immune modulator.
Interesting.
And it is pretty selective against senescent cells. Then you got like FOXO4 DRI, which is great, but very expensive.
And again, you need to go at it with a light hand. Like, you can't overdo this stuff.
Yeah. And which you kind of have to, unless you're really rich. But so we're trying to get it cheap so people can use it.
There's also some herbal formulas out there right now. Like, I don't know if you've looked, Qualia just came out with a pretty interesting formula called senolytic, nothing like using the right word.
Yeah.
And, what's nice about it, I think, is you're less likely to have a reaction like you had. And it's a pretty sweet formula. Like, it's got a lot of, it's got the high dose quercetin, it's got the fisetin in there, it's got some pretty nice elements. And I think for the DIYer at home, if you will.
And the question, though, is there's kind of 2 pathways you need to knock out.
Yeah.
One that's like the fisetin or curcumin will knock out one side and stabinib with the other. Is there anything that's knocking out that other side?
Yeah, I don't know. I would have to look at. I'll have to send it to you, and I'll send you the ingredients. You'll have to look at it.
It's tough. I mean, because there's not a lot of research in it,
Right.
But they're getting there, and kind of all the anti-aging things right now are kind of like, okay, boost the mitochondria and that, well, you're really doing the right thing. You may or you may not be. Starting earlier works better, but once you're past a certain level, you want to probably get rid of those cells. And if you're sick, and my thought is that some of these patients that are young Lyme patients that are really sick, there's no great test for senescence currently.
No.
Is that we're getting early success knocking those out, and then using the therapies.
So the senescent cells.
Yeah, where we tried the therapies initially and they didn't respond, like, hey, how about this? Let's try to get rid of this. And I don't see that many patients. Was kind of little, I have a lag. I have to convince the other doctors to do it, but they do it and they're like, wow, it started working now.
Mm-hmm. So it's like you take out the trash and you have more room to work, right?
Yeah.
So, but the idea of, and I think more and more people are talking about aging in the context of the immune system. So, and we were talking about this earlier, with, I call it SIRS, you call it SEERS, the CIRS.
I butcher everything because I don't talk to people. So
no, I do too.
Myself, and I have to, I call whatever, it sounds good to me.
Whatever it is. But SEERS, long COVID, all of these things, and at the bottom of it, aging.
Yeah. And
It's an
long
immune
COVID,
issue.
yeah, long COVID also wipes out your mitochondria.
Right.
Yeah.
And so it's high inflammation, mitochondria get wiped out, and your immune system kind of has been
Yeah.
disabled essentially.
And, one study, they did lung biopsies and they found there was no TB4 in the lungs, in COVID, and stuff like that. And there's so many things that treat COVID. I guess I should probably not go there, but
Well, there's published studies online, right? Like, I mean,
there is, but God forbid you talk about them.
I know.
Yeah.
Listen, I mean, but with TB4 that you just mentioned, thymosin beta 4, it's a naturally occurring peptide in the body. I think the FDA's pulled it, like compounding pharmacies are even not allowed to make it anymore.
Yeah. And thymosin alpha 1.
And thymosin alpha 1.
They banned it because it was safe and effective for COVID.
Yeah. And amongst many other things. I mean, it's approved in 30 countries, right? So so let's talk about this a little bit. So you found a little bit of a workaround here. And, it's a different approach, and it's using a class of peptides that I love to talk about, that not a lot of people talk about yet, but I think there's a tsunami coming with these things, and they've been being studied for 40, almost half a century, right?
You start reading the literature. This is my problem. And you're like, oh my God, wait a minute. And then, so you get another one, and then the sun comes up and they're like, oh, you got a patient waiting,
Yeah. And so we're talking about bioregulators, guys. And, one of the many things that I love about Dr. Holtorf's book here is that you're actually leaning into a few of the bioregulators. And you mentioned earlier that one of the big problems was the pineal, pituitary, like that whole axis gets dysregulated. Well, there's a bioregulator for that. And there's a bioregulator for the thymus gland. And, what if we could get those killer cells kind of fired up again? Or Treg cells, actually, it's the Treg I'm thinking of.
And if you look at the studies, even in the reduction of cancer, and the mortality, it's like, it would be the biggest blockbuster drug ever. Oh, and by the way, it's non-toxic. Try to take a toxic dose. You can't find it. You can't take, it's less toxic than water. You try to take how much water, you die. But and so I ran into a friend who had a lab who they're big into big pharma, and they do all the metabolomics, transcriptomics, proteomics and stuff. And I said, hey, I want to see if I can replace thymosin alpha 1 and with all this. So it turned out to be thymogen, which is basically a thymic peptide. And you're I think the first one ever figured it out.
What's that?
Immune peptide A2, right?
What's that?
And you go, that's Vylon.
Yeah. I'm like, immune peptide A2, what is that? And I go in, I'm like, oh, it's a bioregulator. It's Vylon, the one that nobody talks about ever.
Yeah. Well, we got a letter already just immediately saying, you better not use that term, like, okay.
Which term? The bioregulator term?
Vylon.
Oh, why? Is it, it's not patented, is it?
It's registered.
But what is it? A 2 amino acid sequence?
Yeah. Well, the name is, the name.
Oh, the name is, okay, fine. So whatever.
So it's immune peptide A2, but,
okay.
And then, so they both had a little different, basically their whole, basic metabolic, fingerprint, were a little different, but we looked at thymosin alpha 1, which does have multiple domains as well. And so it really fit, and was much more potent too. So we put those out, which also nice. You can't take thymosin alpha 1 orally.
No.
It's big, and these were orally. So that's thymogen alpha 1.
That's a good name, by the way.
Yeah, thank you.
Because it takes people a minute to kind of go, wait, what?
Yeah, and so we have a lot more of those things coming out, but we're just it's everything's crazy. It's like everything does go wrong, but and supply chain issues and stuff. But we excited. We have a big pipeline of stuff coming out that
Yeah.
we're excited about.
So for the thymogen alpha 1, though, in terms of, because I know that with thymosin alpha 1, sometimes with people that are really sensitive, if they take too much too soon, you remember you mentioned that it's a seesaw between TH1 and TH2. What I've observed in the community that I run is that if people that are really ill and out of whack take too much thymosin alpha 1 too quickly, it's the equivalent of some big kid jumping on the other end of your teeter-totter and sending you flying off.
I totally agree. And I noticed too, with a little separately, but if I take too much thymosin alpha 1, I can feel my bone marrow, my spine expand. That's what it feels like.
Wow.
It is the most painful thing ever. And
Interesting.
Like if I know it's going to last like 8 to 12 minutes, right? So I can deal with it. If it was going to last an hour, I would have to go to the hospital, you know. But,
Really?
yeah, but that's why I do tox studies on all the peptides. I tell you what kind of all the side effects are. But I also noticed when I was sick, I got reactions to almost everything, right? And I'm like, well, I'm allergic to it. No, not really. It was my TH2 was so high that all these foreign objects, it just starts attacking it. And that's why we see with these chronic infections and this, you know, SEERS, chronic Lyme, people, like almost all of them have PANS, even though it's not diagnosed. They have, you know, so many autoantibodies, but they don't fit into any little pattern. Like I had antiphospholipid syndrome, I had chronic kidney disease, autoimmune kidney disease. I had, you know, my ANA was just gigantic. I had so many autoantibodies, but they would come and go. And then as I got better, I could take those same peptides without any problem.
Interesting. So you just weren't reacting negatively to them. What about, and then for the thymosin beta 4 that you've put in capsules, and you think it's important for people to understand, this is not the 43 amino acid TB4 that they're used to taking. These are fragments of thymosin beta 4 that are active, that have very much more specific activity. And one of those fragments is actually very specific to the heart, which I thought was really interesting because a mutual acquaintance of ours had sent me a paper not that long ago talking about how there are studies that show that thymosin beta 4 can help restore stemness of cardiac cells.
Yeah.
And it's got to be these fragments. Yeah.
Yeah. And so the first 4 amino acids are very immune modulatory. It's probably the workhorse for the immune modulatory portion, and very antifibrotic. And
yeah.
One thing that they do is they lower human transferring growth factor beta, which is the biggest cause of fibrosis. So let's say someone with post-MI, it will lower that and prevent that inflammation and that scarring.
Right? That diminishes the function of the heart muscle down the way.
And same thing with kidney function, you know, chronic kidney function, which is huge. And the same thing with the I mean, I don't remember the name. I mean, peptide A2 does the same thing. And a lot of them do it, you know, somewhat. Some are a little more specific for human transferring factor beta. And sometimes it's just that someone happened to do a study on that, right?
Right.
But, yeah. And when you combine, I think the big power is, and we talked about, you know, epitalon, the pineal peptide, also pinealion, is that they kind of reset everything. They're kind of that master peptide. And then you add that to a thymosin, and that's probably the best anti-aging insurance you know, policy that you can get. And we talked about, you know, the study that, you know, patients with significant cardiovascular disease over 65, followed them for 15 years or so, only gave them a couple years, like 6 doses of, or the late one, 6 doses of
Right. We'll edit this part out. All good.
Yeah. So 6 doses of it. And it showed that, you know, quality of life, mortality, cardiovascular mortality dramatically less. They live longer, all-cause mortality, They got, less infections. They had higher quality of life, higher endurance, all those things. They were younger. And what's the downside? We haven't found one.
No, no. So you talk about epitalon in your book. Where does it fit in for you in dealing with essentially, a disabled immune system, let's say? So in these situations with mold and sears, and you talk about bringing epitalon into the picture, which
Yeah,
nobody else is talking about right now, right? And pineolon is more of a central nervous system peptide bioregulator, whereas epitalon is that pineal master gland regulator.
well,
So,
I think they're actually much closer than you think.
okay.
I think it just kind of got put in that little segment. But because we're finding that both of them will bring back menses in people and raise anti-malarial hormone. And it's amazing. I was telling you where they took out the pituitary in chickens and gave them epitalon, epitalon, and their thyroid levels went up. Like, well, wait a minute, there's no pituitary to make TSH. How the heck did that happen? But and they'll fix deiodinases, so metabolism of the thyroid. They kind of reset everything, and they work very well with the thymic peptides. And if you look at as we age, right around what is it, 12, 14, your thymus starts involuting.
That young?
Yeah, it will start, especially.
I thought it was at 30. Okay.
Well, yeah, you kind of don't see a huge decline, and it comes down, but it will start. And it depends also toxins, obesity, stress, and all those things. And so now, and that modulates the immune system. So you're starting to age, and just that, basically, if you just fix that, dramatic reduction in cancer, dramatic reduction in diseases of aging, cardiovascular disease, cancer. Like, why aren't we just giving that? It's cheap. It's extremely rare to have a side effect with it.
Yeah, I haven't seen it. I mean, I've seen a couple of side sometimes, and it's funny, there is a thyroid bioregulator. And I mean, the literature says it is modulatory. It will restore normal function. It seeks to restore normal function to the thyroid. So if you can use it with someone who's hypo or hyperthyroid, it'll look to modulate. Now, I've heard in the group a couple of times, some people with thyroid dysfunction where they went at it too hard and felt that it was too much of a stimulus too fast. But one of the things that came back to me from the St. Petersburg Institute of Bioregulation and Gerontology is with people with a lot of autoimmune issues, they will often use the synthetic bioregulator first before they use the biologic, because they find it's maybe because it's more specific.
Yeah.
And there's not all those cofactors. Like, it's kind of more of a bullseye, right? It's going to go right at one thing, and it's more simple because you don't have all the other cofactors that they may be, which is part of the beauty of the oral, like the capsules, that can maybe help to rebuild the tissue in different ways. But with the synthetic, they're finding that it causes less trouble.
Yeah. And you kind of know what it's doing. But yeah, and with autoimmune, it's like we kind of don't even think about it anymore. It's like, oh, I got MS, okay, and we find too is that like people with chronic fatigue syndrome and Lyme, and they got POTS, like they go, what about the POTS? Don't worry about it, and it just goes away, and it's all about the immune modulation.
Yeah,
and it just fixes all those different things. And if you see also, it kind of like a little pearls, like people will have a really high ACTH but a low cortisol. And so what happens is the body is trying to raise that cortisol because they got adrenal dysfunction.
Yeah.
And it's secreting corticotropin releasing hormone, CRH, which is a potent mast cell stimulator. So just giving a little cortisol to bring that ACH, which bring that CRH down, they often go, oh my gosh, my basically POTS has gotten better. Basically I'm not peeing all day. Yeah.
So it decreases the mast cell activation.
It decreases the mast
It
cell.
decreases. Yeah.
Yeah. And that's where we found just, start with immune modulation and let's see what gets better. And then let's say they still say, oh, I got some brain fog. So we'll use like, oral cerebral lysin, or C-Lank, C-Max, some of the mitochondrial peptides.
So at that point, you bring those in. Yeah.
Yeah. Dihexa, like we had one of our doctors, I don't know if I should say this, but somebody's daughter, like totally a cheerleader, just perfect kid, but OCD pulling all her eyebrows out. They tried everything, therapy and all this stuff. And we gave her, we gave her 5-amino-1-MQ. And 2 days later, no more.
Come on. Why?
Yeah.
5-amino-1-MQ, mitochondria.
Yeah, raising mitochondrial function and just no longer a problem. Though I have found sometimes we've done it for a while, it stopped working, and then we said, okay, we either go off it or give like PQQ or MitoQ or SS31, and it starts working again. So I think we kind of we used up the antioxidants in the mitochondria.
And so have you tried that with OCD again, or is that the first one? Or
yeah, that we just haven't got I haven't seen any patients. I'm sure the other doctors have, and I don't know if I haven't heard back.
Yeah, that's interesting.
That reporting, and we're very much dinosaurs. We still paper charts. So yeah, we got to work on that so we can do some better studies, but we're starting that. We just started KJ Biopharm to do FDA trials, and which is a bigger pain in the ass and more expensive than I could ever imagine. But I think
but coming out the other side, you've got paper, right?
Yeah, and it's like, damn it, I'm going to prove to these suckers that you send a patient back to a doctor. Like we have ALS patients come in wheelchairs, they're jogging, and they go to their neurologist, and the neurologist goes, oh, must have been a misdiagnosis. Oh, 3 of you,
So this is all from immune modulation, taking care of the mitochondria, like basically getting the body. And I think, it definitely we're oversimplifying a bit here, because looking at the book, in the book, you're talking about a lot of different things here.
Yeah.
Talking about MSH system, and it's not a one and done. I don't want people to think, oh, all I got to do is get my hands on
is take this and boom, you're better.
Yeah.
But I'll tell you a case we just started. I said, let's start treating vets for free, right?
Yeah.
Seem to be treating almost everyone else for free. So, and he came in, he had severe PTSD, depression. Then all of a sudden he just went down. They said it was a seizure, but he wasn't post-ictal, but cardiac inflammation. He had rhabdomyolysis, was put him in a coma, was in the ICU for forever. But he had been seeing VA doctors for years, and they're all like, well, we think it's psychological. Here's some Zoloft, And so just through someone, we saw him, and he got an injury during combat. He was special forces, and a big rod in his leg, and he couldn't move his foot. And so he came in, and I'm like, well, this is free, so we got to go fast. And so we injected a number of peptides, some growth factors, and sent him home on, kind of this mix of immune modulators. And within 2 weeks, within 2 weeks, dramatically better. He can move his foot. Within 2 months, full range of motion, and he had allodynia.
What's that?
You touch his skin, it just killed him.
Oh,
like he couldn't wear pants or anything like that. And I'm sure he had toxic exposure,
Sure.
and mold. And we kind of did it even before getting the labs. It's just kind of like, well, no, you're going to have this. And he did come up positive for mold, hugely high C4A, human transmission growth factor beta, low natural killer cell function. So, fit that pattern. And depression went away. He basically had no more depression. He went camping after that, after it was basically disabled.
So this is all from essentially going at it from the perspective of the immune system, which of course is also going to go after inflammation. And
it was not a great case. It was a kind of a reckless way to do it, but we're like, this guy needs it. And then and after even just the injections, this other doctor he had allodynia and is smacking his leg. And I'm like, what are you doing? And he's like, a nerve. And I'm like, really? So it's amazing how fast sometimes that it can work. I'm not saying, hey, this is guaranteed, take this, you're gonna, but and so many things went away, like it's brain fog, you couldn't concentrate. And then he just sent an email that he read a book, and which no way he could have. His endurance was, he was the toughest son of a gun ever. And his endurance was so low and so fatigued, and now he's just kind of back to normal. And we didn't really have to do that much with it,
That is amazing.
Yeah, and my bet is he has a chronic infection and stuff going along with that, but we didn't even look because he's fine. And I think we kind of neutralized the toxins, and next to the burn pits and stuff like that, he turned positive for mold. And instead of trying to get rid of the mold, you modulate the immune system, and you can BPC, TB4 frag shown to protect the body from the consequences of the mold.
Right.
But still, where's that coming from? And you don't want to stay in rule number one: get out of wherever that.
Get out of the moldy environment. No, for sure. Yeah. But as you said at the beginning of the podcast, a lot of people get exposed to whether it's mold or Lyme and never have symptoms. And that's essentially a functioning immune system that can take care of the house, right? And hold the dogs at bay.
Yeah. And that's what we have. People, I remember we had a family and they were farmers. Whole family was so sick. And at that time we had a live cell dark field microscopy with immunofluorescing antibodies. So we could see, all these bugs, and the dad was fine. And he was like always working out. And I looked, and he had more babesia than anyone I've ever seen, second person. But he was fine. And the rest of the family was sick, and you could barely find anything in him, and his immune system was great. I don't know how, but it shows you it's like, it's not what it is. I mean, he probably had less toxin somehow, or, so he was able to handle that infection.
Well, what's the expression? It's not the germ, it's the terrain.
Yeah.
Right.
And toxin is the dose. Yeah.
That's right. So it's, these are important concepts. And anyway, I'm super excited about all the things that you're doing right now, and your book that's coming out, which I think, like I said before, I think it's going to help a lot of people. Like in some ways it's technical, but in many ways, certainly to the biohacker crowd, to the crowd of people who are frustrated by the conventional system, who aren't getting answers, and who've now taken it into their hands to get educated and to become literate about a lot of this stuff. And I see them in my group all the time. Like, I'm amazed at how much, lay people know and understand. They will get their hands on a book like this, and it really lays out for them. It's almost like a primer. Like, you go through every system and explain how, leptin influences TSH, for example, or whatever the case may be, so that people get a better understanding of how things tie in, and then bringing it back to the immune system and what can we do to re-engage.
Give them a core concept to understand.
Yeah.
And I make a joke all the time. I say, give the same presentation to doctors I do for patients, but I dumb it down for doctors. And Tony, it's they just have more common, the lay people and the healthcare providers have more common sense. And I think they're just more open to it. And so many doctors, like, they come in like, okay, we got to You have to unlearn everything you've got,
You
So
think you know. So, okay, so I know you don't have a lot of time because you have to rush off to another meeting, but so in the current integrative peptides lineup, we have some new players. So we've already talked about thymogen alpha 1, which is our Thymus and whatever that name was of the bioregulator we're not allowed to say. And Vilon, and that's really for rebalancing or breathing life back into the Th1 side of the immune system. And it might take a little, I think, for me, what I see with bioregulators is they take a little bit longer to kick in than a thymosin alpha 1, which is more of a, it's a direct hit, if you will.
Yeah, and we'll see. I can't give the clinical how that compares to, let's say, the TB4 frag. We have to wait and see because we had, these in vitro studies and things like that in vivo, but more like, hey, this person made all these different metabolites. Well, how does that clinically respond?
Yeah,
so we'll see what the difference is, and
for sure.
And it may be, hey, I like using all of them, so. But yeah, and then go ahead.
And then there's the TB4 frag, which is really interesting because when you look at the fragments, it's got a big application for anything cardiac, heart, but also immune.
Yeah, so that's also a Th1 booster, but very anti-fibrotic, works for chronic kidney disease. Really, lowers that, increases immunity, but lowers that fibrosis. And it's very specific also for human transferring growth factor beta, which is we're finding a big problem for all these chronic illnesses, or most of them.
So human transforming growth factor beta, just why don't, you've mentioned it a bunch of times. Why don't you explain very quickly why this is an issue? I know you gotta go.
So it tends to go up early in a disease, and it's thought to be anti-inflammatory, and it does have some, but once it's around for a long time, now it basically causes a shift in the immune system. It activates all the inflammatory markers, fibrosis, and it's a cause of a lot of chronic illness.
Perfect. Okay, great.
And it really suppresses the hypothalamus, pituitary, so it has a lot of those effects. So it causes a lot of vicious cycle.
Great. And then the last one that I'll mention, because you still have the cerebropep and BPC 157 oral, but then you brought out the KPV as a sublingual spray, which I think has taken a lot of people by surprise. Like I've gotten a lot of people in my group going, integrative peptides isn't doing KPV capsules anymore. We need to find another source. And I'm like, but they've got the sublingual spray. And they're like, it's not going to work. And I'm like, well, it's only 3 amino acids. It's only tiny.
And to be honest, we've had some difficulties because we test the heck out of everything, right?
Yeah.
And the capsules, we've had some surprisingly, they weren't absorbing like they should, so we don't use. So we've kind of done some things, it will be back. But we want to make sure it's right.
It's a bioavailable enough. Great. Yeah. And then KPV, of course, it's this anti-inflammatory, great for gut inflammation.
I love KPV, for any autoimmunity, inflammation. But they'll be back because I bet someone it's going to overtake BPC. So we're going to make it.
Them's fighting words. But in the meantime, I like the sublingual spray. I even don't mind the taste of it.
I'm so tired of taking pills. So,
I think it's nice to have options to pills for sure. And even for people with compromised digestion, it can be really challenging. So, okay. So I know you've got another meeting to run to. So why don't we just leave it with, why don't we let people know where they can find out about the book when it's available? Will that be on your website? And
you're making me pressure's on as a book. It's
the podcast won't be out. This podcast will not air. We're recording this mid-September. It will not see the light of day at earliest until November. So just know that you have a minimum of 2 months to get it together.
But it's an ebook. It's not a whole book. But we got another book coming out. But it should be out by the time this airs. So
Okay.
It'll probably be extended with an addendum and.
For sure. And a bunch of other chapters on the website. So to get the book though, the ebook would be holtorfmedical.com or what's the website?
That would go to mybettermedicine.com.
Okay.
They can also check out our nonprofit, the National Academy of Hypothyroidism, nahypothyroidism.org. Kind of the stuff about thyroid we're talking about. Integrative peptides is kind of for the peptides. We're starting a training program on the October 29th will kind of be the launch.
A training program for what?
Peptides.
And that's
peptides and other stuff.
And other stuff. And is that through?
That's official. That's the name.
And other stuff. And is that through mybettermedicine.com or?
Yes.
Oh, amazing. Okay.
So it'll be like a year long. In fact, I'd love to have you part of it, by the way.
I'm in. I'm all in. I'm writing it down. Training course. Okay. Well, this has been fabulous. And guys, if you want to get your hands on any of those peptides, the oral peptides we were talking about, that's integrativepeptides.com. And I believe we have I think longevity is the discount code that will save you 10% if you decide.
If not.
No, I'm pretty sure it is. People have been using it.
Okay.
And that's it. I'm going to thank you so much for your time tonight. It's been a pleasure as always.
You're awesome. You make me smile, and your brilliance just lights up the rooms. Thank you.
Thank you so much. And I can't wait to do your course and to finish the book. So have a great night. Thanks so much, Kent. Take care.
Awesome. Hey, thanks so much. Bye.